Hello and welcome to the Patient Education series. My name is Christian, I'm an optometrist, and the aim of this series is to provide some information in plain English to those who want to know more about common eye conditions. Perhaps you've been told that you have cataract, glaucoma, or macular degeneration, and you're not quite sure what that means. Or perhaps you want to support a relative or friend. My hope is that after watching these short videos you'll have a clearer understanding of various eye conditions and I'll offer some helpful tips to support you. I welcome your suggestions for any topics you'd like me to cover in the future. And if you find this video helpful, please subscribe so that you're kept up to date as new videos are released. Welcome to the Patient Education series. Today we're going to talk about posterior capsular opacification. In a nutshell, posterior capsular opacification is something that people can get following cataract surgery, usually months or years down the line, where part of the lens becomes a bit cloudy and the vision starts to get a bit hazy again. It might seem like the cataract's coming back, but don't worry, it's not. The treatment for this is straightforward. You have a little bit of laser treatment done. You do this while you're awake and sitting at a machine, a bit like when you visit your optometrist. For those who'd like to know a bit more about it, I'll now go into more detail. Let's start off with some basic eye anatomy. This is the same image that I used in the cataract video, and you might find it helpful to watch that one if you haven't already. So this is the front part of the eye, and this is the lens inside the eye, which is where cataract forms. The cataract will have already been removed, which has allowed the light to pass right through it to the back of the eye, which allows us to see. In posterior capsular opacification, or PCO, the back part of the lens gets a little bit cloudy, and that means that less light can get to the back of the eye, and you may well think that your cataract is coming back. As an optometrist, when I look inside your eyes, this is what it looks like. You can actually see here the edge of the implant, this white line around here, and then you can see this kind of white cloudy stuff. And that's actually right at the back of the lens, as I mentioned, it's getting a bit cloudy and a bit hazy. And using a slightly different light source, you can again see the edge of the implant here, but all this kind of cloudy, bubbly stuff in the middle, which will be affecting the vision. What would you notice as the patient? Well, actually it's very similar to what you noticed when you had cataracts. So the vision can get more blurry, colours can look a bit more washed out, and you'll probably notice more glare, and that could be during the daytime or during the night time. Well, why do people get posterior capsular opacification? Well, roughly 20 to 50% of all patients who have cataract surgery do end up with this. And the good news is it is quite straightforward to put it right, as I mentioned. It could be due to surgical technique, it could be due to the type of implant that you had put in during cataract surgery, or perhaps some complications which occurred during surgery. Diabetics also tend to have a slightly higher risk of getting posterior capsular opacification. The treatment for posterior capsular opacification is much more straightforward than the treatment for cataract. You don't need to go into surgery. Some drops are put in to numb the eye, and you'll sit on a machine that looks a little bit like this, so something that you're used to seeing in the optician's practice. And the machine that they use is called a laser, called a YAG laser. And the procedure is called a capsulotomy. So otomy means to make a hole, and capsule is because this opacity forms in the posterior capsule. It's that part of the lens which is left after you've had cataract surgery. And that's the hazy part that we were looking at on the previous slide. As the laser is applied, it makes a hole in that cloudy posterior capsule, and that's exactly what you can see here, this nice clear part in the centre, and you'll see they still need to do a bit of laser on the outer part here because it's still cloudy. Eye drops are often given for 1 or 2 weeks afterwards just to reduce the chance of any inflammation. The procedure itself only takes about 5 or 10 minutes. And the vision improvement is almost instantaneous. Within an hour you'll probably notice a significant difference in your vision. Thank you for watching this video on posterior capsular opacification and the YAG laser which is used to treat it. I hope you found that helpful. Thank you.